our video, don't forget to subscribe to our channel. So the first question will be like, what is your name and what does it mean? So you'll have to tell your name, and you'll have your name might have some meaning. So know that meaning and try to talk something about it. Okay. So the next question will be like, if you get both NEET PG and UPSC seat at the same time, and if you could choose only one, then which one will it be and why? So at this time, it is not needed that you talk very good about UPSC and bad about NEET PG. It's not like that. They want you to be honest with your answers. So whatever you feel, you just tell it to them. You feel like you NEET PG is better, you just tell them. And the reason why you are attending this UPSC interview, you tell whatever you want. So people at the panel like you to be honest. Okay, so you'll have to tell which one would you choose and the reason for choosing the one and not choosing the other one. What contributions can you make to the society as a doctor? So this question is, you must have heard it a lot of times. So but I know everyone would say like serving the society, serving the poor. That is really true and that is really good. But if you could say something more other than these things, so if you could say something that can impress the examiner, so it will be a better answer. Because if they ask this question to 10 people, out of 10 people, 9 to 10 will be saying the same answer, that is to serve people. So you can also uh, tell about your own thoughts, and it should be really good answer. Okay, so tell me about a memorable case that you have managed in your internship. So this is a bit of a tricky question. So they are asking this question, and if you say like a very serious case, and then what will happen is that they start keep on asking about that case, how did you manage. So you make sure when you answer these types of questions, the case that you are going to tell to them, you should know everything about that case. So it is, if you ask me, it is better to be on the safer side and tell like something which you know completely. For example, like managing a diabetic ketoacidosis, and managing a tuberculosis patient, and those kind of things. So mainly they will ask about the emergency cases. For example, like this trauma patient, what will you do initially? You are suspecting a patient to have tension pneumothorax. So what will you do? Will you take X-ray or not? What will be your first step in management? Those kind of questions. So instead of that, if you say that you did brain tumor surgery, you assisted a brain tumor surgery, which is a very complicated case, and those kind of things, then they will start keep asking questions about that case, and make sure that you should be able to answer whatever they ask about that case. So the next question is, you see a person collapsing at the airport, you did the emergency treatment, but you refuse to accompany the person in the ambulance as you may miss your flight. So is it ethical? So if this question comes for, if you ask me, this is not ethical, because the doctor should accompany the patient until he reaches an hospital. So what, that is usually which is ethical thing to do. But if you have any alternate answers also, you could drop it in the comment section. We'll talk about it. You get a patient who was found lying unconscious under a coconut tree. Will you do MLC or not? So this question is kind of very good question, which was asked to me in my interview also. So a person lying under a coconut tree, so the chances are like the person could have had a injury from the coconut being dropped from a very good height, or someone might have done something to that person and put him under the coconut tree. So if you ask me, it is always the best thing to do is to do a MLC, because the patient was found lying unconscious. How will you make a patient understand that every cough and cold doesn't need antibiotics? So this is a very very good question also. So these questions, they are trying to test your communication skills. So how are you going to explain to a patient like he should not take antibiotic on his own? He should not take antibiotics whenever he's having a simple cough and cold. How are you going to explain him about the viruses and bacteria and those kind of things in a very easily understandable manner for the patient. Okay, so this requires some communication skills. So be prepared for questions like this also. What better could have been done by the Indian government in managing the COVID crisis? So whenever they ask something about the government kind of questions, so first make sure that you, for the first 1 minute or 2 minutes, you talk well about the government. It's like the government has already done these plans, which are really good, and this is the outcome of those plans. These are really helpful for the people and those kind of things. So after doing those kind of things, what you will have done extra or in excess to these plans. So what better could have done? So you can say that people could have we could have made the lockdowns even stricter. So mainly people came out from their homes during the lockdown to earn some money to get some food. So if the government had provided food for all the homes, and they wouldn't have come out. So those kind of things which comes to your mind. Diabetes is a very prevalent disease in India. So apart from counseling about diet, what can you do to reduce the incidence? So whenever diabetes is mainly because of the bad lifestyle, so probably that's a lifestyle disease. And for the lifestyle disease, mostly will what will do to avoid is about what we'll do to avoid is by talking to the patient about the disease and its complications. So here they have mentioned you can't talk about diet, or you have already talked about diet. So what else can you do to reduce the incidence? So you can comment your answers in the comment section. Talk to me about your hobbies. So whenever they ask about hobbies, uh, it's good to say that I like to do teaching to the students. I like to counsel students and those kind of things. It's like really impressive. Those kind of things. Talk about some diseases prevalent at your place. So you can tell that malaria is very prevalent at my place, and then they will start asking about those questions like what is the annual malarial parasite index at your place, and what does it signify? So how's the is malaria endemic or epidemic at to your place or at any other place in India? So how can you prevent it? Those kind of things. So how different is the healthcare system at your place compared to Delhi? So usually they don't compare it to Delhi. They can compare it to any other place, like you might have been to any other place. So they'll ask like, have you been to any other place apart from your place? So they can ask to you about the comparison of healthcare systems at your place and at their place. So generally, if health, if they ask these kind of questions, what you will do is that first you will talk about the healthcare system at your place, then you will have to talk about the healthcare system of Delhi, and then you should compare together, and you should talk about the outcomes of your place and outcomes at Delhi, and you can also suggest some plans which can be implemented at your place or at Delhi. Now, if you are a foreign medical graduate, they can ask the question like healthcare system at India versus healthcare system at your country, at the country where you study. For example, like Philippines, Russia, China. Okay, they can compare the healthcare system. What lessons did you learn from COVID? So this is a very good question again. So you can tell about the medical kind of lessons and other life lessons and all those things you can mix up and give a good answer. This is kind of a controversial question. Mostly these type of questions wouldn't be asked at the interview, but in case if they ask, you should be prepared for it. So right now, currently there's a case being going on regarding NEET PG and those kind of things. So they can probably ask some kind of questions related to it. For example, like after MBBS, people can start earning better. So do they still need a reservation system for PG as well? So what they are trying to ask here is that during after your schooling, okay, you're not earning, so the reservation system helped you. But even after becoming MBBS doctor and after starting to earn, do everyone still need a reservation system for PG as well? So there is these kind of questions can be asked. Again, this is a controversy, and this answers debate can go very long. These kind of questions are generally not asked, But regarding the current situation, this can be asked. So be prepared for anything and everything. Your favorite specialty and why? Now, this is a very, very important question. And with this only, you are going to decide how your interview is going to revolve around. So you can tell your, for example, if you tell your favorite specialty is cardiology, and then immediately the internist starts asking you about, tell me about the pulse noted at mitral stenosis. Tell me about the character of murmur here in aortic stenosis. So how is hypertrophic obstructive cardiomyopathy presents? So which is systolic murmur, which is diastolic murmur, those kind of things. And then the obstetrician can ask about the postpartum cardiomyopathy, those kind of things. Many questions will be asked from the specialty which you are going to choose. So you are going to roll the interview. Okay, you are going to decide which question can be asked to you. So if you tell like you are going to be a neurosurgeon, then those kind of questions you can expect from them. So be truthfully, tell whatever you want, but at the same time make sure that you know about that specialty very well. Okay, so these are few questions which are expected to be asked at this year. So all these questions, I have referred to the previous year students. So all from this 15 question, this includes questions, some of the questions that were asked to me and some of other people who attended last year interview. So these questions, these kind of questions can be asked again in 2021 exam also. So if you think that answering these questions is easy, then you have a good aptitude and good knowledge. So what you can do is that you can just practicing these kind of questions to start with. Because whenever you go into an interview, the first person asking question to you is the AS person. And then the first impression is the best impression. So the first few questions, you should be answering very boldly and very clearly. So you should not be like scratching your head and trying to think that time. So what you will have to do is you'll have to answer boldly, and you should also be prepared for any type of questions. So while answering the questions, make sure that your aptitude and your attitude is very good. Okay. So these were some of the questions which are expected. So you can also comment down your answers for these 15 questions with the numbers nearby. And in the next few videos, I will also talk about the medicine, surgery, obstetrics, gynecology, PSM questions expected for this personal interview. So let's start. So this in this video, I've arranged the questions according to each system, because basically in medicine, usually they tend to ask what is your specialty of choice. So you may answer any one of these systems as your specialty. So basically questions will be revolving around that system only in the medicine part. So make sure you answer wisely. So to start with the cardiology, if you say you wanted to become a cardiologist, they might be asking any of these questions. So they can ask, where do you see water hammer pulse? There is the Corrigan's water hammer pulse. So it's you should answer about how the pulse is felt. Uh, uh, you should also tell where it is felt. That is in aortic regurgitation, and you should also describe the pulse. So they can also ask, tell me about the conditions causing systolic murmurs. Remember our mnemonic MRS, ASS. So you can tell those conditions. Then they can ask, how is hypertrophic obstructive cardiomyopathy different from dilated cardiomyopathy? So you can tell the differences about systolic dysfunction, the diastolic dysfunction, and decrease filling, decrease in output, and all those kind of differences. And then they can also ask causes of ST elevation. So we should be telling the ST elevation, MI, acute pericarditis. You can also tell hypothermia and all other causes that you know. Then they can ask about BLS. But one thing important here, don't when they ask about BLS, don't just jump into checking the pulse and checking the respiration and the pulses. You should be telling about the checking the scene safety, calling for help. All those steps are also equally important as the upcoming steps. So make sure you don't miss the initial few steps, which are usually given in the guidelines. So this question is probably expected this year. So please do learn about the BLS, the ratio of CPR and breaths. So the 30 is to 2, 1 rescuer, 2 rescuer breaths, and all those things. So then the most frequently asked question when you say you wanted to become a cardiologist is that how will you manage acute MI? So you should start telling from the diagnosis, that is from the ECG part. You should also tell about the loading dose. So you can then tell about the management. You can also talk about PCI stenting, cabbage procedure, and all those things. So then they can also ask you about management of acute decompensated heart failure. So make sure you know the mechanism of action of Lasix, the side effects, and giving oxygen, and when to give beta blockers and when not to give beta blockers, and all those things. So whenever you say about any drug, make sure you try to explain about it. Explain the mechanism of action and the side effects, so that the panel members gets impressed about your way of answering the questions. Then they can also ask you about the complications of hypertension. So when they ask you something kind of a general question, make sure you go system wise. So complication of hypertension start from the brain, tell about the strokes, tell about the bleeding conditions, and then come to the eye, tell about the eye findings in hypertension. Then you can tell about the cardiology, heart changes, left concentric hypertrophy, and all those kind of things about the output. Then you can talk about the renal system. You can tell about the nephrosclerosis part, and you can also talk about accelerated hypertension, hypertensive emergency, hypertensive urgency, all those kind of complications commonly seen in the hypertension. Make sure you also know how to manage the hypertensive urgency and hypertensive emergency, the IV, giving drugs in IV. So now, if you say that you want to become a neurologist, these are your questions that probably might be asked. So what are the newer treatment options for migraine? You can talk about this a lot. You can keep telling about the botulinum toxin, the supraorbital transcutaneous pacemakers. So sorry, not pacemakers. So you can also talk about the newer drugs that have been coming. So whenever you talk about this, you also make sure you tell a little bit about the first line drugs, the prophylactic drugs, and all those kind of things. So how is a seizure different from epilepsy? You should be answering this question wisely. So read the updated new guidelines, whatever it is given. So then you should also be answering how you should also be knowing how to differentiate lower motor neuron lesion from upper motor neural lesion, the in which you can see clonus, in which you can see fasciculation, and all those kind of things. And then they can ask about the Guillain-Barré syndrome. Make sure you know about the ascending paralysis and the treatment options like IVIG, all those kind of things. So this is also an important question. They can ask about diseases causing dementia. You can talk about Alzheimer's dementia, Parkinson's, Lewy body dementia, and all other different types of dementias. And make sure you know how to differentiate one from the other. So you can they can also ask about treatment of Parkinson's disease. So whenever they ask about the treatment, make sure you tell them in the group wise, category of drug wise. So you take one category of drugs, tell about all the drugs, then go to the next category of drugs, tell about it, and then finally tell about the surgical deep brain stimulation maneuvers and all those kind of things. So whenever they ask about the treatment, make sure you also talk a little bit about the prognosis of the treatment. So they can in neurology mostly they can ask about the management of stroke. So whenever they ask about the management of stroke, don't immediately talk about the management of ischemic stroke. Start from how will you receive the patient. So what is the golden time, and when to send for CT, how to rule out hemorrhagic stroke, how to manage if it is hemorrhagic stroke, if it is a ischemic stroke, how will you manage, and talk in detail. So this is also an important trick that I have to tell here. So the interview runs around for like 30 minutes. So whenever you tend to answer in detail, so the number of questions that will be asked to you is less, and at the same time you will be giving a good impression of answering questions in a better way. What is paraplegia, paraparesis, semiplegia, hemiparesis? What is diplegia, quadriplegia? So make sure you know the difference of these small things. The next important thing, if you want to become a chest physician or uh, so you want to do in respiratory medicine, so these are the questions for you. So they can ask about the newer drugs used for TB and their regimens. That is the bedaquiline, delamanid, britomanid, and their regimens used in XDR-TB, MDR-TB, how many months, intensive phase, maintenance phase, and all those things. How will you manage acute severe asthma? Make sure you start from the oxygen nebulization, and then steroids, magnesium sulfate, and non-invasive ventilation, and all those things. So these questions, this question they can ask you. Tell me about COVID and ARDS. So how is COVID causing ARDS? You can talk about the cytokine storm and all those kind of things. So how will you manage pulmonary thromboembolism? So this is also an important question. You should know how to diagnose it initially. So you should know the findings to diagnose it, and then how about using the heparin, or if any surgical intervention is required. I can also ask you about the IVC filters, which are upcoming treatments in developing countries. So steps in intubating a patient. Now, this is a very expected question to be asked this year because of the COVID. So how will you intubate? So you should start from the initial steps till you should also talk about the size of intubating tube, ET tube used in males and females, and the Macintosh blade and all those kind of things. Also, you should be going step by step how to intubate. Different modes of ventilator also can be asked. You should talk about the SIMV, ACMV modes, and all other modes. So your experience in managing post-COVID lung fibrosis. So you can tell about incentive spirometry, then Intina tablets, and all other kind of things. So make sure you learn about this, and also a little bit of mucormycosis. So if you want to become a gastrointestinologist, and so you should know about these questions. How to interpret LFTs. So you should know how to what will be elevated in alcoholic liver disease, what will be elevated in other liver disease. You should know about the bilirubin levels, when it is elevated, what to do. So all those kind of things. So then the next thing they can ask you is that prevention of hepatitis B and C. So you can talk about the vaccines and about screening and blood transfusion and all those kind of things. So liver cirrhosis and portal hypertension management. Make sure you know about the medical management in detail, even if it is very little. So you should know about it properly. So what are the types of hepatorenal syndrome? Type 1, type 2. So H. pylori therapy regimens, the triple, quadruple therapy regimens. How will you treat a patient with H. pylori? How will you diagnose it? So Crohn's disease features, and how to manage the acute flare-ups of Crohn's disease, and those kind of things. So if you want to become an endocrinologist, so what will be the differences between SI-ADH and diabetes insipidus? So you can talk about the water deprivation test, water loading test, and the main differences in the osmolality. So then they can ask about diabetes mellitus, oral hypoglycemic agents and its mechanisms. Make sure new drugs are coming. So you should know about the mechanisms and most importantly, side effects of each drug. How will you manage DKA? So this is also a commonly asked question. So you should talk about the fluids, IV insulin and insulin drip, managing the hypokalemia, so acidosis and all those things you should know. Now, this is a very important and very much expected question. If your question revolves around the diabetes mellitus topic, so the new drugs SGLT2 inhibitors, the dapagliflozin, canagliflozin, so these drugs are now increasingly used in cardiac and renal disorders also. So make sure you know about the advantages of these drugs in cardiac and renal disorders also. So how will you diagnose Cushing syndrome? You should know about the dexamethasone suppression test, the low dose, high dose suppression, and all those things. And then how will you come to a diagnosis? So how will you treat hypothyroidism in pregnancy? Basically know about the surgical interventions and basic thyroid function test laboratories. So other miscellaneous questions that can be asked is management of gouty arthritis. So initial management insights and allopurinol, when to use febuxostat, allopurinol dosing can be asked. Tell me about HIV first line drug regimens used in India. So you can talk about lamivudine and tenofovir regimen and what are the alternating regimens, when will the alternating regimens be used, why it is used, side effects and all those things. How will you calculate the anion gap in ABG? This is an easy question. Tell me about malaria prophylaxis. So first 6 weeks, what will you do? For more than 6 weeks, what will you do? CSF analysis of bacterial, viral, and TB meningitis. So know when to, what are the indications of doing a lumbar tap, and how will you differentiate these conditions? So we can be asked about the Jones criteria and rheumatic fever prophylaxis. And this is also a frequently asked question, management of snake bite, because most of them would have been posted in PHC. So you should be knowing management of snake bite. And then this is a tricky question that I have given here, management of kerosene poisoning. So whenever we say poisoning, we tend to go with the stomach wash. But you should know that in kerosene poisoning, stomach wash is avoided. So these are some of the previously asked questions and the expected questions for UPSC CMS 2021 personal interview in the medicine topics. So make sure you know the answers of all these questions. You can also share your answers in the comment section. So that's all for medicine. So don't forget to subscribe to our channel. We'll be seeing you in another video. Thank you.